Well, the province's health department has announced that there is one new case of COVID-19 in Happy Valley-Goose Bay. The woman was granted a travel exemption as an essential healthcare worker. Now, she's not a resident of the province and traveled from Saskatchewan. As a precaution, Shahashee Innu School and the MTIE board office will be closed for the next 2 days. The Director of Education, Ganani Davis, hopes testing will clear everyone and expects to have school reopened on Monday. Now, to talk more about this COVID case in the region, Health Minister John Haggie is on the line. Good morning, Minister Haggie.
Good morning.
So how concerned should the residents of Central Labrador and really all of Labrador be right now?
The risk, according to public health, for the general population is low or negligible. Some of the advisory has been done out of an abundance of caution. We are, as our contact tracing evolves, moving into areas where we're recommending people who are in locations be screened or contacted, should contact 811. And in the past, we've done that very much on a person-based approach. So we're broadening our criteria for contact tracing, and this has coincided with this case in Labrador. So the risk is really very low.
So how does testing work here in Labrador, in this case specifically? Will people be tested and will that be then sent out, or will the testing be analyzed here?
There are several machines available through federal government under COVID that are based in Labrador itself, and there are ones in Goose Bay. These are the Gene Expert test. The test itself is akin to ours in the sense that it's the same kind of approach. And because of that, the first batches of cases will have to be validated in the same way ours were. So they'll all be validated here in St. John's. So they'll effectively be double tested. So they'll be tested locally, and the result will be available fairly rapidly locally. That will be a presumptive, and then the definitive one will come when that same sample or a sample taken at the same time is checked out through the public health lab in St. John's.
Now, this worker has been in the community for about a week and a half. At what point did she develop the symptoms?
My understanding is they developed symptoms after arrival. It is not clear from our investigations yet whether that was when work began or shortly before.
So she wasn't symptomatic when she was on the plane and in the past week?
Apparently, she's not been symptomatic on the travel into Goose Bay.
Could you remind us, Minister Haggie, of the rules around isolating for an essential healthcare worker?
Well, essential workers have a category of their own, and we do need people in healthcare to come from the island or out of province. And Labrador Grenfell has had these kind of arrangements for a long time, both in Goose Bay and on the coast particularly. The rules are essentially that on arrival, while not at work, they are required to self-isolate. When traveling to and from their workplace and at work, they don't, but they have to follow certain protocols. They have to, for example, mask all the time. They should not mingle outside of work, breaks and this kind of thing. So it is a bit of a different environment, but that is common for all essential workers, and that has to be for the first 14 days after their arrival.
So what is the case here? Are you still looking into how this possible spread could have happened?
Yes, I mean, the bottom line is we don't have all the facts we would like to make a determination. There is an assessment and investigation ongoing, and out of an abundance of caution, the advisories, additional advisories around the stores and around the flight were issued. And we'll conclude our investigation and see what options we have at the end of that.
Minister Haggie, do you know what Labrador Grenfell Health does to provide basic information to workers that it does bring in?
Well, the exemption, I can't speak to the Labrador Grenfell HR process, and I think you'd best address that to them. But in terms of the process of an exemption, the individual themselves, even though the RHA might ask for the exemption, the person travelling actually has to possess it to get into a point of entry. And on that exemption are links to our frequently asked questions and resources under the special measures orders outlining what our expectations are for people who have exemptions. So it may be a bit of a generic form, but there are specific links for essential workers or rotational workers or people coming in for compassionate reasons, for example.
And these healthcare workers who are coming in, are they being tested, right along the travel period and first when they arrive, or how's that working for them?
No, what we did with rotational workers, because of the environment from which they come and which they work, either camps or work sites, they are regarded by public health as being in a different category than essential workers who come and go. We do not use testing in any of those situations unless people have symptoms, and that's been the case from the get-go.
So we're at a point now where we know that she has symptoms and she's been tested positive here. She's gone out into the community. But what about her at work? I mean, she's a healthcare worker. What are the risks of contact where she is at her workplace?
That is something that Labrador Grenfell, along with public health there, will be working out. Because again, if the precautions that are required in terms of masking and PPE are followed by the essential worker in the first 14 days, the risk is felt by public health to be low. But what will probably happen is a list of contacts from the point of view of patients and staff will be generated by the investigation through public health that's ongoing, and those individuals will be contacted by public health if need be and given appropriate advice.
We've seen the school in Haggie close its doors for the next 2 days as a precaution of this case of COVID-19. Do you think that more places should be doing something similar to that?
I wouldn't be able to speak to the logic or the reasoning behind that. I don't know if there have been contacts, for example, with staff or students at the school with this individual. So I wouldn't be able to give an informed answer to that. I think the basis of decisions should be advice from public health locally on the ground, and I would leave that comment to them.
Now, a lot of people have called into 811 in the last day or so since this announcement has come out, and there's been some long waiting periods on the line to speak with somebody there. Is there enough staff to deal with the contact tracing that's going on right now and enough tests here in the region?
Dealing with the last question first, we have checked with the Labrador Grenfell and Public Health, and we're not aware of any supply issues. There are reserves and stocks that can be drawn upon. In terms of the other elements of that, we advised 811 as soon as we were aware of this case that there would be a surge in their calls, and they would kind of man up appropriately. My understanding is that has happened. Whether it's adequate or not, we'll see when today's utilisation stats come out. They usually come out about 9 or 9:30 to the department. That's island time from PhoneMed. As far as public health in Labrador are concerned, public health in Labrador, in actual fact, is probably the most skilled and experienced group of contact tracers we had in the province from their previous experience prior to COVID. And I think, indeed, that was shown when I think our initial case in the province was a case in Labrador. So we have not been made aware of any concerns from a staffing perspective there. Obviously, later on today, we'll have our regular check-in with them and see if there's any needs that they have that are unmet. But at the moment, we're not aware of any.
Minister Haggie, as you can imagine, a lot of people here are very concerned about this case. And Happy Valley-Goose Bay is a hub for all the communities along the coast and whatnot. Should they be overly concerned at this point, or what message do you have for people here in Labrador?
The message for the people of Labrador is that the risk to them is low or negligible depending on their level of contact with this individual in the window during which she was not self-isolating for work or whatever reasons. We, through public health, will be able to trace and identify those individuals who need to contact 811 and get advice. And the new bit is that we've introduced the concept of people who are in a certain location at a certain time, and that will probably generate a lot more calls, I suspect, than would otherwise be the case. It's perfectly understandable. I appreciate everyone's concern. But the level of risk of going into a store under these circumstances for a general member of the public is in actual fact extremely low. It's simply that we've done it out of an abundance of caution. Public health will give appropriate advice and recommendations to those individuals. And I think the challenge we have is to try and deal with people's concerns and fears rather than the virus as much as anything else, because given the information that I have been given at the moment, the risk to the general population of Happy Valley-Goose Bay is very low.
And so at what point will we know, when this case is done and the risk is gone and we don't have to worry about it anymore? Where are we in the whole process?
By and large, if you look at the way the disease pattern has gone with contact tracing in this province, pretty much within 48 hours of the index case being identified, public health have been able to track down a significant number of the contacts. Indeed, our metric is around 80 to 90%, which is amongst the best in the country. So once that process is done and they have been tested, that's really when you'll know the level of concern. If we don't see any cases in the next 36 to 48 hours, any more positive cases, then I think people can feel really reassured. If we do, then we'll have to deal with that as the situation evolves. But at the moment, public health feel the risk to the people of Happy Valley-Goose Bay, and by extension, the areas it serves, is actually low.
If there is an outbreak, is Labrador Grenfell Health ready to deal with that?
Yes, and we have the ability to bring extra resources in if they feel they need them. We have these contingency plans for each of the RHAs and for each of the regional referral centres. So there's no concern about a lack of a plan. The question would be what level of implementation and what kind of resources would be necessary, and that would be left to public health and Labrador Grenfell on the ground to come back and ask us for what they needed.
Minister Haggie, thank you so much for taking the time to speak with us this morning.
You're more than welcome. I hope the comments were helpful. Have a good day.
You as well. And that, of course, is the province's Health Minister, John Haggie.